Good afternoon and welcome to our 12th lecture. Today's lecture will be presented by Audrey Menti from L62 with an interesting topic, broken heart syndrome. I hope this talk will be beneficial to all of us. Without further ado, let's invite the presenter to take the floor.
Good afternoon, everyone. How are you today?
I'm great.
My name is Audrey Menti and I'm from L62. For today, I have an interesting topic to share with you guys, and it's called the broken heart syndrome. So, have any of you ever heard of the syndrome?
Yes.
Yes? No?
You told me yesterday.
Okay. So, the content or the objective of my talk today, I'll be talking about what's the definition of a broken heart syndrome. Also the features, the test and diagnosis, the risk factors. Risk factors is actually the characteristic that a person has, which increase the likelihood of them from getting this syndrome. And I'll also be talking about the prevention for this broken heart syndrome and also how to treat them. So what is broken heart syndrome? Anyone of you know?
Sadness, depressed,
Breakup.
friend zone, divorce.
Okay, so a broken heart syndrome is it's a sudden temporary weakening or stun of the left ventricle, which is the result of severe emotional stress or physical stress. Example of emotional stress is after the death of your loved one, or after divorce, or after breakup. For physical stress, for example, is after surgery or after an asthma attack. This broken heart syndrome can also known as Takotsubo cardiomyopathy, that's how you pronounce it, or stress cardiomyopathy, or apical ballooning syndrome. So, okay. This picture A shows how the heart looks like if you have a broken heart syndrome. So as you can see, the left ventricle is ballooning, so that's why it's called apical ballooning syndrome. It's also called Takotsubo because it comes from the Japanese word, which is this one. It stands for vessel, which is this one. What it means, Takotsubo, is it's a vessel which the Japanese people use to catch octopus. So it is called this Takotsubo because as you can see in picture A and in picture B, they kind of look the same, right? So this syndrome is first discovered in the Japanese. So when they first diagnosed this syndrome, that is what they thought. They thought of Takotsubo. So what causes the left ventricle to expand is because under stress, you're releasing adrenaline. So what this adrenaline do is that it stuns the heart and it prevents the heart from beating efficiently. So I have a short animation on how a broken heart pumps or a normal heart pumps. It's very fast, so I'm going to stop at a certain time, or I will repeat it a few times. So as you can see, the broken heart, the atrium is actually contracting, but the left ventricle is not contracting. It's expanding. And if you see just now, it's not pumping very well. Let me repeat it again. See, it's not very pumping compared to the normal. So, what are the features of a broken heart syndrome? So, a broken heart syndrome is, it always confused to heart attack because the symptoms are very similar. You will have chest pain and also shortness of breath. But doctors, they differentiate, how they differentiate heart attack and a broken heart syndrome. There are a few tests they can do. So one of the example is they will perform a coronary angiogram. So what this a coronary angiogram is, the doctor will inject a type of dye that is visible to X-ray scans, and then it will inject it to your blood vessels. So at the X-ray scan, the doctor will view the inside of your blood vessel, and what the doctor will see is that if you have a heart attack, you will have a blockage on your heart artery, while in broken heart. So that is one of the tests for broken heart syndrome. There are 3 others. What the doctors can do to know if you have a broken heart syndrome. So there are 3 others. So the first one is the doctors will get your chest X-ray, and from this X-ray, the doctor will see if your heart is enlarged or not. So if your heart is enlarged, then you have a broken heart syndrome. The second test is the doctor can take your blood test. This is because when you have a broken heart syndrome, there's an increase of certain enzyme in your blood. The third task that the doctor can perform is by using electrocardiogram. And how this procedure for this test is, the technician will place wires on your chest, and it will record electrical impulses that produced by your heartbeat. And then from these signals or the electrical impulses, the doctor can detect if there's irregulation in your heart rhythm or your heart structure. Electrocardiogram, you cannot detect heart attack using it. So, risk factors. As I said earlier, risk factors is the characteristic that a person has that increase the likelihood of them to get this broken heart syndrome. So one of them is postmenopausal women, which is women at the age of 50 or older. This broken heart syndrome can affect both men and women, but it affects women more compared to men. There's actually no precise reason why women affect more to broken heart syndrome, but there's one term. They they have more adrenaline receptor in cells of your heart. So, which means men probably handle stress better than women. Okay. This broken heart syndrome can also occur on people with anxiety or depression. So, can affect both men and women, but it affects women more compared to men. There's actually no precise reason why women affect more to broken heart syndrome, but there's one theory said that men, they have more adrenaline receptor in cells of your heart, so which means men probably handle stress better than women. Okay. This broken heart syndrome can also occur on people with anxiety or depression. So, the prevention. Unfortunately, there's no non-prevention for a broken heart syndrome. But if you do yoga and meditation, it can actually help you to reduce the chance of you getting this syndrome. Because as you know, yoga and meditation can help you to reduce stress. Okay, so one of the treatment is time. For broken heart syndrome to heal, the patient recovers in weeks or within 48 hours, or there's some patients took longer. This broken heart syndrome, it heals just like that. So the scientists have not discovered how it occurs like that, but it recovers with time. If you do go to the doctors when you have the symptoms, you go to the doctor. The doctor will give you some medication, what this medication do is that it blocks the adrenaline that affect your heart. So I include some additional facts. So one of it is, if you're under extreme emotional stress, your heartstring can break. So if you guys don't know what heartstring is, it's actually a cord-like tendon. It helps the papillary muscles and also the valves together. And what this tendon do is that it prevents, so this is between the left atrium and this is the left ventricle. So if blood tries to flow back, this heartstrings, it will prevent the valve from bursting open to the other side. Another fact is that happiness can also cause broken heart syndrome, but it's very rare. 40%, there's 40% cases from 4% cases. This may be because happy and negative events share a common emotional pathway to the central nervous system, which can trigger this broken heart syndrome. I think that's all. Thank you. Do you guys have any questions? no. I think. I'm not sure. I haven't researched until that. Yeah. Yes.
How come happy can cause broken heart? Happy can cause broken heart.
It's because of the happy and negative apa tuh? The happy and negative events it shares common the same pathway to the central nervous system, which trigger the broken heart syndrome. So that's why if you're happy, you can have broken heart syndrome also. I think it's depend on how you handle your stress. Yeah. Yeah. Yes.
That food release stress. That food release broken heart. Kalau makanan ini boleh boleh mengurangkan stres tidak makanan atau menambahkan stres.
Depends, I think.
Lihat kerasa kali itu belum.
Apa makannya bawa orang stres?
Any more questions from the girls? Yeah. That part I haven't searched. Yeah. So you can search it up. Yes.
Can the broken heart syndrome leads to death?
Yes, it can. Because since when you stress, adrenaline is produced, and if you're exposed to this adrenaline for too long, it can actually damage your heart, so you can die from it if it's not treated. It's very rare though. Yeah.
Has anyone in Brunei died?
I'm not sure about that. Yes.
How do you know you have broken heart syndrome? Naturally, according to the doctor. How do you know you have broken heart syndrome? Naturally, we are going to the doctor.
You experience chest pain. Yes.
How does the heart feel like?
It breaks.
Yeah.
About that, I'm not really sure why, but I think because when you have a broken heart syndrome, your heart is not pumping well. So since oxygen needs to be pumped to the rest of the body, so it pumps harder. The heart pumps harder. So I think that's why it breaks.
So, if we have a broken heart syndrome, the left ventricle expands, right?
Yeah.
So it increases in size.
Yeah, it increases in size.
So when you recover, does the effect of increasing size permanent, or will it return to its original size?
It returns to its original size.
How?
Naturally.
So basically, one way to treat it is something that can return it to its original
This syndrome it occurs naturally, like it heals with time. But if you decided to go to the doctor, you can ask for medication.
Does broken heart syndrome relates to depression? Does broken heart syndrome relates to depression?
Operation,
Depression.
depression. Yeah.
So there are few like pills.
Yeah. It only expands on the left ventricle.
Say that broken heart syndrome will heal naturally every time, right? Yeah. How does it lead to that?
The broken heart syndrome leads to death. As I said earlier, since I think this question already been asked. I think. How many times? If you're under stress, adrenaline is reduced, right? So what if you're not treated, or you do not try to reduce your stress, what this adrenaline can do is that it can damage your heart. So that's why you can die. Any more questions? Yes.
Once you heal from broken heart syndrome, does the chance of
Again. Can you get the syndrome again?
does it increase? The chance of having it increases, or this?
So far, scientists discovered that this broken heart syndrome cannot occur twice. If you once get it, then after you heal, you will not get it again. Well, in rare cases, it does.
You mentioned that once the person heals, there is a reduced chance. You said there's no chance. There is no chance that will heal again.
Yeah.
Maybe reduced chance. You want to continue to heal.
Any more questions? Thank you.
Thank you for the interesting topic, and thank you for sacrificing your lunchtime to attend our talk. And if any one of you is interested in giving a talk, then please do say